So our first presenter is Anna Chupak. The title of her presentation is Optimism in Risk Perceptions in Response to Rapidly Evolving Health Risks.
Hey, good afternoon, everyone. My name is Anna Chupak. I'm a PhD candidate from the University of South Carolina, and today I will be presenting my team's findings on risk optimism and protective behaviors during and after the COVID-19 pandemic. My advisor, Dr. Caroline Rudisell, she led this project, and we collaborated with Dr. Costefont, who is from the London School of Economics and Political Science. So these are just some brief acknowledgements to our wonderful funders. So optimism bias is defined as a tendency to overestimate the likelihood of positive events and underestimate the likelihood of negative events. This can help us maintain self-esteem and avoid discomfort. However, this is often in the short term. It can also have many beneficial effects, such as for our mental and our physical health, such as expecting positive outcomes can reduce stress and overall worry. However, on the other hand, optimism bias can also prevent us from accurately anticipating risks and can lead to poor judgment. So, for example, optimism can cause us to underestimate the budget and time needed to complete a project. And this is often caused, this is a common error, and it's called the planning fallacy. So during the COVID pandemic, people underestimated their personal infection risk of COVID-19 and related severe outcomes such as hospitalizations and mortalities, and often overestimated the risk of others. Optimism bias with regards to risks led individuals to undermine their motivation to follow health guidelines, and this ultimately reduced engagement in socially desirable protective behaviors, such as wearing a mask and getting vaccinated. Optimism bias is believed to result from knowledge resistance and distrust in science. This often can be caused by misleading media, and this in turn leads to greater misperceptions of risk and lower vaccine uptake. So our study sought to study optimism about both known risks. So in this case, at this time during the pandemic, it was food poisoning and flu, as well as study emerging risks such as COVID-19 and how it changes with experience. We also sought to assess how optimism bias influences welfare improving behaviors, specifically individual decisions regarding receiving the COVID-19 and flu vaccines. And then lastly, we distinguished two types of optimism, the first being survey-reported optimism from private optimism, which depends on the availability of various personal information. So our study conducted a repeated cross-sectional survey design. For our study survey, this included various questions related to health behaviors and related factors such as trust, optimism, as well as infection risk. So for our dependent variables, these included influenza and COVID-19 vaccination intentions as vaccines became more readily available. And for our primary explanatory variables, we included perceived, personal, and average person risk of becoming infected. So participants were asked, what would you say the risk of you personally becoming infected with the following types of illness in the next 12 months? And then they were also asked that for the average US resident. So participants' responses were on a scale of 0 to 100, with 100 being the greatest risk. These risks included food poisoning, influenza or flu, and COVID-19. And then we used these responses to determine and calculate our survey-reported optimism. So this is simply the ratio of risk perceptions of the average US resident over risk perceptions of self for these different types of risks. And then lastly, we predicted private optimism based on personal information. So this personal information came from our survey, and this was predicted based on mental and physical health status, gender, highest education level, household income, household finances, now versus pre-pandemic, as well as the year that the survey was conducted. In addition to our primary explanatory variables, we also included various secondary. This included proximity to COVID-19, so one's infection history, as well as trust in health organizations listed here. And finally, we also include likelihood of a person to have an annual health checkup now versus before the outbreak, as well as self-reported physical and mental health status. And then lastly, we have various individual demographic covariates such as gender, age, and work status. So in terms of our descriptive analysis, we calculated we calculated several means and standard errors of each variable using our sample weights. We then conducted weighted t-tests across and within survey years for both 2020 and 2023. So this was done for the different types of risk perceptions, as well as the survey reported optimism. For our multivariate analyses, we ran hierarchical OLS regressions to estimate the intentions to receive COVID-19 and flu vaccinations separately. And this was done to look at parameter stability. And then lastly, we ran various bivariate probit regressions to estimate vaccination intentions jointly. So this was done because we found a moderate to high pairwise correlation between both vaccination intentions. We also stratified by survey year, as well as compared survey base versus private optimism using conditional marginal effects. And this is all the models were adjusted for the various sociodemographic and covariates, as well as US region. So in terms of the results, so overall we had a sample size of over 3,000 US adults aged 18 to 75. So that's combining both the 2020 and 2023 surveys. So overall, most respondents did intend to receive the flu and COVID-19 vaccine in 2020 and 2023, as well as when we combined both surveys. We found that these intentions to receive these vaccines were greater in 2020 than 2023. And that was for both COVID-19 and flu. And then in terms of our weighted t-test analysis results, we found that overall perceived risk of others or other US residents were greater than personal risk for both years and all risk types. So this is kind of already giving us an indicator that there might be some optimism bias. Overall, we also saw similar trends between years for personal and average perceived risk. So just to give you an example, we saw that food poisoning for both personal and average increased from 2020 to 2023. And we saw that for COVID in the green, that declined in terms of perceived risk from 2020 to 2023. And then for our weighted t-test for optimism bias, this is just our survey-based bias. We found that overall COVID-19 optimism bias was greater in 2023 versus 2020. And when looking at within survey years, we found that respondents overall were more optimistic about food poisoning than risk of flu and COVID-19 in 2023 compared to the average person. And then looking at our bivariate probit results, so this is for both our survey-based optimism index here, and then further down, that's our private optimistic based index. And I just kind of circled the results for optimism, but we also have our other secondary explanatory variables as well. So this one is indicating that optimism for both survey-based and private optimism is associated with lower COVID-19 vaccination intentions. And then similarly, we found that it was also associated with lower flu vaccination intentions. And then lastly, when looking at our conditional marginal effects, or DY/DX values from our bivariate probit results between both types of optimism and vaccination intentions, we did find that private optimism was overall a better predictor of vaccination intentions, so had a larger magnitude or stronger effect. And I won't go into too much detail, but this is just showing the two types here of optimism, private and survey. And then for each type of vaccine, so flu vaccine, COVID-19, flu and COVID. And this is showing our different combinations of results to whether you said yes or no to each type of vaccine. So neither you would say, no, I would not, or I do not intend to get vaccinated for this specific illness. So overall, in terms of our summary, Most did intend to receive COVID-19 and flu vaccines. This was greater in 2020 than in 2023. We also found that perceived risk for others was greater than perceived risk for oneself, and that vaccination behaviors in 2023 appeared to be more impacted by disease-specific perceptions of personal risk than in 2020. For optimism bias, we found this was associated with lower vaccination intentions. Therefore, if someone was more optimistic about COVID-19 or flu risk, then they're less likely to get vaccinated, especially for that specific disease. And then those who are more optimistic about COVID-19 in 2023 versus 2020, overall, we found that they're more optimistic, but as this indicates that as COVID-19 became a known risk, or they have more experience with the COVID-19 pandemic, people are more likely to become more risk optimists. And then lastly, private optimism was found to be a better predictor overall than our survey-based optimism. So I'm happy to take any questions at the end. And thank you.